Coming straight to the point, today it's all about mental health. But do you think people, even now in India, consider mental health as important as physical health?
Sitting here in 2025, people are also considering mental wellness. And that's a very positive thing. And right, Ghar ka murgi dal barabar, they say these statements. So the one thing that people need to understand is talking is not therapy. Preaching is not therapy. Therapy is a more systematized treatment.
Coming to social media versus real life, can you take us through the social media pressure that the teenagers are going through?
Social media only shows the positive side of an individual. I would never post a picture when I'm extremely sick. I would never post a picture when I'm untidy. And now that whole comparison starts.
Okay.
And the results that have come out till now are very scary.
Hello everyone, I am Bansari Trivedi and welcome to another episode of The Social Scoop. Today we are going to talk about something that we are all dealing with, rather struggling with all alone, and we don't like talking about it. Yes, I'm talking about mental health, stress, anxiety, fear, emotions, habits, and much more. Our today's guest is not only a psychiatrist, but also a mental health expert who can read the human minds inside out. He not only deals with teenagers, but also adults and older generation. Our today's episode is all about rebellious teenagers, overworked adults, social anxiety, social fear, social media pressure, anxiety hacks to addiction myths, and the road to self-discovery with none other than Dr. Virinchi Sharma, a well-known psychiatrist in Hyderabad. Hello, Dr. Virinchi. How are you doing today? Welcome to our show, The Social Scoop, and welcome to our studio located at Delhi Public School, Nacharam.
Firstly, thank you. Thank you so much, Bansari, for inviting me here. I'm doing absolutely fine and I'm super excited to be a part of this. I don't know if you know this, but I am also part of the DPS family because my daughter studies in DPS, not in this branch. She studies in a different branch.
Amazing.
So, that gives me all the more excitement, all the more happiness to be here. And I love the studio, like I told you, super congratulations, firstly, for starting up something like this. And let's roll it.
All credit goes to our chairman, Shri Malka Komaraya sir. He's always been upfront to, set up studios that not only help us do some amazing work, but also help students in learning amazing subjects and coming up with their own projects. Coming straight to the point, today it's all about mental health. But do you think people, even now in India, consider mental health as important as physical health? That's question one. And question two, yes, definitely, psychologists and psychiatrists are given much importance now, but do you think even now they are only looked up to when they have something called mental disease? What is the difference? I would like you to, educate our viewers that what exactly is mental health, and seeking therapy and health is not equal to mental disease, first of all.
Well, firstly, if you look into the timelines, 40, 50 years back, there was a lot of taboo about, seeking mental health treatments. And, when we try to look at, the times 20 years back or, 15 years back when we were students, when we just started, learning about mental health, there would be a lot of people who would come down with a mental health issue or a mental health illness, and they would seek treatments. But with the changing trends, what I see right now, sitting here in 2025, people are also considering mental wellness. And that's a very positive thing. But yes, compared to physical health, still there is a lot of stigma in regards to mental health. People feel that probably going to a mental health expert is a sign of weakness, or they feel that, we are going to be labeled as, people with a mental disease.
Yes.
And
yes.
Unfortunately, a lot of times, be it multinational companies or corporate offices, though they talk about, mental wellness, when it comes to employees, they still have these kind of notions, and that's what people directly tell us. So probably this could be one reason why people still have that stigma. But I think, with a lot of awareness programs, one like what we are doing now, there's a lot more understanding that people are getting. And the good part is, there are teenagers, there are young adults who are stepping out, talking to their families about their psychological health and asking for treatments. So I see that as a positive sign right now.
Talking to families, and when we talk about talking, do you think really just talking helps or talking to the right person helps?
Well, I think this is a very interesting question because it's quite often where young adults uh, brought to the clinic or the hospital by their family members. It can be parents or uncles or aunts. The first thing that the family says is, "We have been counseling him for a while. We have been doing everything possible, but sometimes you all understand, right? Gar ka murgi dal barabar." They say these statements. So the one thing that people need to understand is talking is not therapy, preaching is not therapy. Therapy is a more systematized treatment in dealing with psychological health or psychological health issues, and it's better if individuals don't do that. The most important thing that we learn in therapy is you need to be a good listener rather than being a good speaker. But unfortunately, at homes, most of the times the scenario is the one that is suffering is asked to listen. And there are a lot of preachings that happen
Yes.
from different parts of the family,
Which is
So,
not helpful.
absolutely. And rather that's going to uh, worsen the individual's confidence, worsen the individual's self-esteem. It's going to make them shy off from actually taking therapy, because when they are told that this is exactly what treatment is, they get worried and they get scared. So one straight line that I would like to tell all the individuals is, if you want to be a good therapist, be a good listener. And therapy is not what everybody does. Therapy is something that people do with a proper education, with a proper license. So always approach a good clinical psychologist, a psychologist, or a psychiatrist when you're looking for a proper therapy.
Is that why you think teenagers and kids are rebellious? Do you think this is what fuels them more?
Well, when we talk about teenagers, now let's try to look at what exactly happens inside their system. Biologically, there is a lot of influence of the hormones.
Correct.
And these hormones are very aggressive, or they make the individual more impulsive.
Okay.
But at the same time, in that age group, a very important brain area called as the prefrontal cortex is not yet developed.
Okay.
So now, without the logical center in the brain being developed, and with some hormones which are causing impulsivity, this makes the individual rebellious. Keeping the biological aspect aside, socially also, they are, walking into new environments, new experiences, and at the same time, their personality is still being developed. So a combination of these hormones, the personality yet being developed, the prefrontal cortex not yet totally developed, and different challenging environments makes the child more rebellious.
So, are you trying to say that the brain is not yet developed until they are 18, not totally developed until they are 18?
Right.
Oh my God.
So now when we talk about this particular area called as the prefrontal cortex, science says that 18 to 21 is when the prefrontal cortex is actually developed.
Okay.
So, every kind of stress that we put upon these individuals before this age group is too much for them to take. But unfortunately, now the society expects, there's a lot of pressure coming from the society, coming from the family, coming from the social media, and all of this now makes this particular brain frustrated. And a lot of times, these negative emotions come out in the form of rebellious behaviors.
Okay, so does that also mean the way they deal with stress, fear, anxiety, all things put together while they are 18 and 21, will that frame them who they are as a person for the rest of their lives?
Actually true. Because now this prefrontal cortex is like a protective layer to the brain, or it's like a bulletproof jacket that an army person uses while going to war.
Okay.
So the bullet can be fired, but when you have that bulletproof jacket, your ability to deal with it is better. There is still an injury, but the injury is not as severe as it is when there is no bulletproof jacket.
Right.
So undoubtedly, a strong prefrontal cortex is one that protects. But if you look into today's lifestyles, there's a lot of stress introduced at a very young age, and that kind of damages the prefrontal cortex. Undoubtedly, despite all these factors, in the recent times, if you look into unhealthy eating habits, and a lot of exposure to electronic media, screen time. All of this also has a negative impact, which makes the individual more rebellious.
Coming to social media versus real life, can you take us through the social media pressure that the teenagers are going through? When I deal with students inside school, outside campus, and when I was a journalist, when I worked with you, I spoke to other teenagers. They tell me that, ma'am, we want to be like one that is shown in the screen. Why don't we have a life like that? Why isn't my life as the character that is shown in web series? And also, when I talk about web series, there are several genres: crime, thriller, and a lot more. So do you think that somewhere also affects our mind?
Undoubtedly, yes, because the fact is that we all know that social media only shows the positive side of an individual. I would never post a picture when I'm extremely sick. I would never post a picture when I'm untidy, or when I'm just wearing some household clothes. So we look at the best of somebody, and sometimes the brain unknowingly starts believing that this is the new normal. And now that whole comparison starts, where I want to be like them, I want to dress like them, I want to travel like them, I want to post pictures like them, I want to buy expensive things like them. And this starts putting a lot of pressure. The second thing is, this whole terminology of fear of missing out, the FOMO that we talk about.
Yes.
FOMO is something that is, something that we commonly see in individuals who use a lot of screen time. There is a landmark study called as the ABCD study. This
Okay.
is Adolescent Brain Cognitive Development Study,
Okay.
where this is a study happening in the US on over 10,000 individuals for a time span of 10 years, looking into their brain and how the brain is responding to excessive screen use or social media use.
Okay.
And the results that have come out till now are very scary.
Okay.
What the results say is greater than 2 hours of social media increases the risk of depressions, anxieties, and suicides in children.
Okay.
And to my knowledge, everybody is using at least 4 to 6 hours of screen time every day.
Yes.
So somewhere what you see, it could be entertainment, but subconsciously the brain starts changing its expectations. The brain wants to be like that, and when that level of expectation is not reached, this brain, which is not having a very strong prefrontal cortex, can go into a very bad state, which could be a great psychological disease.
Is that the reason why not only teenagers but adults also, who have a huge time of using social media, do you think is that the reason why they are not gelling well with the society? They like to be among themselves, they like to chill in their own house and connect with the web series, and they are avoiding socializing. Do you think that's another reason why?
Couple of things here.
Okay.
Now what happens is, a lot of individuals believe that socializing and social media is the same. But there are two different entities, because when we talk about social health, we are talking about that particular brain area which gets activated when you meet people,
Correct.
when you talk to people, when you discuss, when you go out in the environment. But unfortunately, now everything is happening in the social media itself. You're chatting with people on the phone, or you're wishing people through messages. So here, that important brain area is not getting activated.
Okay.
Now, the brain as an organ needs entertainment. Now, this entertainment, or, in scientific words, dopamine, which is the happy chemical. Now, this dopamine can come when I do a 30-minute exercise. The same dopamine comes even when I watch a 30-minute web series.
Okay.
But now, I need to be choosing which is a healthy dopamine. So it's something like, I can be eating dal chawal, I can be eating an ice cream whole day and my stomach is still filling. But I want to eat something that is healthy, which helps in the progress or growth of my system. Somewhere, people are getting all that entertainment through social media. And unfortunately, you get excessive dopamine through social media than the real life.
Because they are working out in social media, eating out in social
Correct.
media, and they are having the fun. Okay, right.
And now this social media is giving all the dopamine. So you don't want that dopamine anywhere else. So now that makes the individual, isolated, restricted to their four walls,
Right.
always in the system. But the risk here is gradually this excessive dopamine that is coming into the system starts eating away the brain. And within a few months or few years, these brains have humongous changes that we see compared to a healthy brain,
Okay.
where there are less number of neurons, where there is less connections between the neurons, all of which clearly is a risk factor for developing a mental health issue.
Okay. Then I think we have to choose wisely now. Now that you have told us that the dopamine remains the same,
Right.
I think it's a huge eye opener for us. Thank you very much for letting us know this. Also, do you think this is one of the reasons why there's a lot of fear, anger, and frustration that we see a lot among adults and teenagers now? Because when I talk to people, they have extreme anger and frustration that they directly tell me, I have punched the wall.
Right.
It's that bad. So, would you like to share something on the same?
So now what happens is, again, coming back to this ABCD study that I was talking about, one important finding this study spoke about is a reduce in impulse control behaviors. So there is a particular brain area which deals with impulse control.
Okay.
So impulse control can be in the form of controlling my anger or controlling my urges to go buy something, to eat something. So these kind of impulses that come in the brain, there is one particular area which tries to say, okay, calm down, relax, we'll do it later.
Okay.
But now, unfortunately, electronic media, screen time is shrinking this important area. And now because of this shrinkage, we see the brain being more impulsive. And let's try to take a very simple example. Probably, when I was a child, coloring used to be where you sit with a book and you sit with those sketches and then you gradually try to fill up those empty spaces. But now I see a lot of teenagers or, children much younger, who shouldn't be using a screen, coloring in that iPad. They click on a button and they click on a button and there's color filling everywhere. And now, if you again look back into another example, when I was a child, when I would watch television, in between the movie, there would be an advertisement, and that advertisement would happen for some 3 to 5 minutes, and I would sit along. But now there is an option called as skip ad. So basically, everything is happening over a click. I click, there is color. I click, things change. I click, the ad disappears. So now the brain starts getting used to this things happening over a click. And now when there are real life situations where things are unfavorable, when things are not happening over a click, this brain cannot handle that. And that makes this brain more aggressive and more rebellious, anger, frustration, like you said.
Yes.
And sometimes even self-harm, which is because they're not able to tolerate that whole waiting period.
But how does self-harm work? Like we see being shown in web series as well. If I'm talking about strictly web series and movies, they show teenagers or adults trying to harm themselves, and that is at the end calming down their anxiety. But would you like to enlighten our viewers that's not how it should work? Also, coming to the second part of the question, you mentioned about brain development and about coloring among children. So when I worked with you earlier when I was a journalist, you mentioned a very good fact that children should not be given cell phones at all until they are 6 years old.
Right.
But we see most of the parents who are not able to handle their children well, they play some cartoon and give it to the child. That also stops their brain development, as I remember what you mentioned.
Absolutely. One, when it comes to self-harm, basically every time there is a difficulty in managing the emotional stress, some maladaptive ways of dealing with this is by creating a physical pain. So when there is a physical pain, the brain gets distracted from the emotional pain.
Okay.
But this whole thing can be done in a more coping way. This can be done in a more socially acceptable way, where distractions can be created in a more positive, in a way that can help the brain grow instead of the brain decline. But unfortunately, sometimes individuals, because of stress, because of anxieties, because of depressions, fail to look into the positive side or fail to look into the more better coping mechanisms, but yield into these kind of behaviors, all of which can be treated with treatments of mental health. Coming to the second aspect, yes, when it comes to screen time, there is so much evidence right now which talks about how spending a lot of time with the screen is causing a lot of developmental delays in individuals, starting from speech delay to, not learning some verbal skills or not learning some motor skills. All of this is happening with screen. Now, see, when two individuals communicate, they gradually learn a very important human skill called as non-verbal communications.
Okay.
So basically, I look at you, and even before you say something, I understand your emotion. So you can look at me and say, "Oh, Virinchi, you're looking stressed today. Virinchi, you're looking sad. What happened?" Now, these skills come when you actually talk to people and when you communicate.
Right.
But now the whole communication is happening with the screen, where
Yes.
it's only a one-sided thing. It's not a two-sided thing. And that causes a delay in a lot of these brain skills. It causes a delay in a lot of these brain developments, and it gradually pushes the brain into a very weak state. And once the brain is weak, it is at a highest risk of developing a mental health issue.
So do you think parents say children have changed? Children say parents have changed. So do you think parents are somewhere not dealing with the rebellious kids in the right way? Or do you think that it's the children, like we mentioned, the food that they are eating, the screen time that they are into, and the content that they are taking in? Do you think it's their mistake or it's totally the parents? Like how teenagers have changed. When you were a kid, your parenting was different. When I was a kid, my parenting was different. But now teenagers are a total different breed. So what do you have to say about it?
Well, one thing that I would like to say is kids model their parents.
Okay.
So there's a lot of modeling that happens. And most parents agree to this, because the first time the child looks at the mother or the father, trying to brush their hair in front of the mirror, the child wants to imitate that. When the father or the mother is wearing boots or shoes, the child wants to imitate that. Similarly, the child also learns to use gadgets, electronic media, looking at their parents. And this starts at a very young age.
Okay.
Like I see my child probably holding a toy and putting it near his ear and trying to say something, probably because he's seeing me or my wife talking on the phone.
Correct.
Now, gradually, this change, or this kind of an imitation that happens continues for a while. And after that, is when we see, when we say that the child has become rebellious now. So probably trying to avoid a lot of these things at a young age is something that we should be looking at. And the second thing is, the way parents are dealing with rebellious children is also, in a very maladaptive way, if I can say. It's something like, there is this famous movie called Check the India, where Shah Rukh Khan says,
Yes.
"Is team ka gunda main hu." And that doesn't work at home. You cannot be that bad guy to tutor the child, because the child is also learning that. He could be afraid at that point.
Correct.
But he is also learning to be bad. So somewhere the way you deal with the child has to change. You need to be, listening to the child. You need to be understanding their emotions. Most important thing, which most of us, are not able to give, is the time that the child needs. The child does not need the screen. Frankly, the child does not want the phone. The child wants you.
Okay.
It is you replacing your presence with the phone. And now the child enjoys the phone, and
There's
cannot.
no coming back.
Yeah, there's no coming back, and you can't change it overnight. So gradually, the parents should change. And again, coming to the eating habits also, it's all what we introduce. Because
Right.
sugars that the child needs can be given in the form of a fruit.
Correct.
But most often it's coming in the form of a chocolate or a cake. And, a lot of these sugars, a lot of these processed food have chemicals which are absolutely dangerous for the brain and the brain's development. And that's also something which is slowing down the brains. When I see teenagers coming and complaining of, attention, focus, concentration, memory related issues. One reason is undoubtedly the screen. The second reason is also the food that they're eating.
Okay.
So these things needs to change. It's easy for the parents to say that my child is learning this from the school, but it's not true. Because, the child has already learnt it before going to school most
Correct.
of the times.
Yes.
And yes, schools also, work with some protocols. I know that, my child, or my wife or me are told not to send some specific foods, during the breaks, which is a good thing. So you want to make sure that everybody is eating healthy. You want to make sure that everybody is, working towards their health, even in the school environment. But the maximum thing should happen at home.
Correct. Talking about trauma, like you just told us, that the way parents introduce the habits to their children. So, if there is a household where a child is growing up, where there are a lot of fights, where there's always shoutings, do you think that also has a negative impact on a child when he or she grows up? And then you mentioned about second brain development that completes when you're between 18 to 21.
Right.
So how can a person help themselves, from dealing with that, now that they are already in grade 10 or grade 11, now that they are 18 to 21, and I hope they are listening, how can they help themselves, get better? How can they do it?
I think, coming to the first question, undoubtedly, yes. It does affect the child's brain. A lot of times, parents feel that the child does not understand what's happening, but the child also can sense that, the tone in which the parents are speaking or the facial expressions of the parents are different from what they normally are.
Okay.
And these aspects are important because the sense of security that the brain develops comes from the family. And when there is disharmony in the family, that has a very clear impact on the child. And a lot of times we see, young school children, having school refusals or, performance anxieties, or, not wanting to talk about a problem, not able to communicate their issues. All of this comes from that lack of sense of security. And now, when this brain starts growing and continuing to grow under these kind of environments, there is a greatest risk of developing anxieties and personality issues. A lot of times, people who have anxious personalities, dependent personalities,
Correct.
or there's a particular personality disorder called as borderline personality disorder. Most of these individuals do have a very clear-cut traumatic experience which started at a very young age. So
Okay.
undoubtedly, parents should be looking at this aspect. They should be making sure that the environment that they create at home, not just the environment, but even the content that they watch on television while the child is around, is very important. And now coming to the second part of it, when we talk about teenagers who try understand these things, but unfortunately are not able to change the unfavorable situation at home, the first thing that you can always do is communicate. Probably sometimes when you say it out, the parents understand it better. When you say that you don't like this, when you say that, this scares you or this creates fear, a lot of times parents get that realization that, okay, a husband might not like it when his wife says it, but he will really change when his son or his daughter says it.
Okay.
So same with, other people in the family. It can be grandparents or uncles and aunts. They understand when the child expresses it. Second, even if that isn't working, I think, there are a lot of, there's a lot of information in regards to this on electronic media. There is a lot of information in regards to this coming from schools. You should always go talk to your counselor at school or talk to someone who's responsible, for, health related activities in school. Gradually introduce some relaxation techniques, deep breathing exercises. So once you start communicating either with the family or with the counselor, you start understanding how do you deal with this, how you process this, and how you come out of this. So communication plays a very important role.
Okay, so communication is important. Otherwise, the way you have grown up, you will pass on the same to your children, and the cycle keeps repeating. Right? Very well said, doctor. And one more question I would like to ask you regarding the same is, what's the right way to set boundaries that doesn't make even teenagers feel that they are being controlled? Because now they don't like being controlled. When we say don't do this, don't watch this, that's the first thing they like to do.
Well, I would again say it's communication, but coming from the opposite side.
Okay.
So a lot of times when parents put in some rules, they've never asked if the child is comfortable with this particular rule. But I think if the parent can sit with the child, let's take a very simple example. If you want to make some, rules in regards to using television, it's very easy for the parent to say, okay, you're not using the TV from now,
Okay.
or not more than 1 hour. But instead, if you sit down with the child, explain them why television is bad, ask the child, why are they watching television? Is it only for entertainment, or is it loneliness, or is it because they don't have anything else to do it at home? I think this kind of a communication can help come out, bring out more answers, more solutions. And also giving that kind of an importance to the child helps the child engage in those activities more. So somewhere, when you're giving the child an option and asking him to set out a rule, there is a higher probability he would stick to that rule than the parent saying, okay, no ice cream from today, okay, you're not eating biscuits from today. Instead, you can ask them, okay, biscuit is not good for health, but I know that you like it. Can we like space it out? Would you like to do it once in 3 days? Then the child may say, no, once in 3 days is too much. I'm eating it twice a day now. Okay, then can we do it alternate days right now? Once we stick to that alternate days, we've already come one step forward. And now you can gradually introduce the other rules. So I would say sitting down and having a conversation with the child and talking to them why these things are important. Same, even if the child wants, to set up some, boundaries for themselves. Like a lot of times children tell us, I don't really like it when my mom just opens my door and walks into it. But, they're not able to communicate it. So I tell them, why don't you just try, sit down and talk to them about it? If it's not happening, then let me come into the picture. A lot of times they're able to deal with it on their own. So they don't need me anymore there. So conversations play a very important role.
But do you think Indian family gives that space to their child? Why do you want to lock the door is the first question that comes up. Why do you need a single room? Why do you need privacy?
Right.
There's no concept of privacy in Indian households. But like you said, communication is the only key, and that is very much needed. In fact, very well said. I never thought why I love watching TV. Being an overworked adult, I love my job. I love what I'm doing. And I like to take up more projects. But then when I get free time, I myself love watching movies, web series, but I never question myself why I like to do that. This is a very good thing that you told us, dear viewers. I think it's time you question yourself as well. And it's not just teenagers, parents, adults, older generation. If you like watching movies and web series, or why are you hooked to the screen time? It's time we also ask this question to ourselves. Moving on to the next segment, we have spoken enough about parents and teenagers. Now let's get on to adult life, their struggles, stress and breakdowns. So teenagers think adulthood is freedom, but adults know actually what stress they are going through. So why is stress and anxiety skyrocketing among adults nowadays?
Well, I think, the lifestyles that we have chosen is undoubtedly one important aspect because the number of working hours, the kind of rest that we are able to give, and at the same time, like I was talking some time back, the kind of food that we are eating, all of it is actually causing changes inside the system, which is nothing but stress. So now when we talk about stress, I'm talking about a particular hormone in our system called as cortisol,
Yes.
which is the stress hormone. Frankly talking, cortisol is a good thing because now let's try to look back at, when you were a student and when I was a student. Probably 1 month before the exam, we were able to do 1 chapter a day. Gradually, 15 days before the exam, we were able to do 3 chapters in a day. 5 days before the exam, we were able to do 10 chapters in a day.
Correct.
1 day before the exam, we did all the 30 chapters. And 10 minutes before the exam, if somebody came and said, okay, the question is coming from this particular chapter, you finish reading that whole chapter.
Correct.
All of this is actually stress, which is positive stress.
Okay.
But now, when this gradually builds up and is not cooling down, that is when the problem happens. So I always give this example. It's like you use a vessel to boil milk. After the milk is boiled, you switch off the light or, the gas. Immediately, if you touch the vessel, it's going to be hot. So basically, just because you switched off the fire doesn't mean that the vessel also has cooled down. It's going to take some time to cool down. But none of us are actually giving that cooling off time in our days. So I start my day with stress, I end my day with stress, I sleep, I wake up and I again start stress. So basically, one, the lifestyle which is increasing the cortisol, and the same lifestyle which is doing nothing to reduce the cortisol. Both of this is one important reason why stress and mental health issues have worsened. And stress is not just leading into mental health issues. A lot of times individuals complaining of basic changes, starting from hair fall to skin changes to thyroid issues to PCODs, to obesities, all of them are coming because of this one particular hormone called as cortisol. And
Okay.
somewhere dealing with cortisol is what we need to learn.
So, can you shed some light on how we as adults can deal with this kind of stress? Some simple habits, like you mentioned, we wake up with stress and again we go back to bed with the same thinking. Oh, I didn't do this today. I'm supposed to do this tomorrow. And the minute we wake up, our mind starts thinking about it the minute we open our eyes. So, can you give us some tips?
So basically, now when we talk about stress, we are talking about a particular system in the human body called as the sympathetic system. So sympathetic system makes you active, sympathetic system makes you anxious. So activating the parasympathetic system, which is nothing but your air conditioner in the room. So when the room is heated up, you switch on the AC and the room starts cooling. So similarly, activating the parasympathetic system cools your whole body.
Okay.
So this can happen with simple deep breathing exercises.
Okay.
One simple exercise that I always suggest is the 4-7-8 technique, where you inhale for 4 counts, hold your breath for 7 counts, and exhale with your pursed lips. So
Okay.
something like,
All right. All right.
so 4 inhale, 7 hold, and 8 exhale. People like to do this when they are anxious, but what I suggest them is do it every day. So metaphorically, I keep saying, if you cannot remove 24 minutes out of your 24 hours for your health, then it's bad. So you need to be at least dedicating 20 to 30 minutes every day for your health. Unfortunately, what we see today is people like to work Monday to Friday rigorously, and and Saturday and Sunday they want to relax. That's not how the body is going to accept it.
Okay.
The body wants the working and the relaxing happening on the same day
Okay.
in that 24-hour cycle. So if you're working every day, make sure that you're working out also every day, make sure that you're relaxing also every day. So physical activity, mental activity, social activity, pleasurable activity, spiritual activity, all of them should happen in a single day.
On a daily basis.
Yes.
Okay. Do you think that's the reason why most of the adults are rather lazy when it comes to weekends, because they don't want to do anything? They like to just be in their own homes, or rather go out for a movie and not do any other
Right.
work, which you just mentioned is not the right way of taking a break. Dr. Virinchi, why don't you tell us one of the weirdest thing a adult has told you that they have dealt stress in this way?
So I remember there was this individual who had come to me with anxiety,
Okay.
and because of his anxiety, he would drink alcohol. So every time he had a performance, like go on a stage, give a presentation, he would consume alcohol.
Okay.
And the funny part was, he would come for therapy, and it was in the second session or third session I got to know that he was consuming alcohol to even come here because he had that anxiety. So to deal with that anxiety, he would drink alcohol and then come
And
for the
meet
therapy
you.
session.
Oh my God. Okay.
So this was very funny, but then we did try to explain him that it's not going to work this way. And he's doing great. He's doing great without the substance right now.
Have you ever met somebody who is or who gets emotionally attached to their therapist? How do you deal with the entire process?
Well, there is a scientific explanation for this, and the terminology is called as transference. So transference is when the client gets emotionally attached to the therapist, and they say counter transference, it's when the therapist gets emotionally attached to the client.
Okay.
And both are very bad for the whole growth of the brain. So one, it regularly happens because when you meet someone with an emotionally dependent personality, somebody having those traits, they get attached to the therapist very easily.
Okay.
But yes, one, scientifically we try to explain them that this is not a healthy thing. We try to draw those boundaries because the end goal is to make them independent of their mental health issues. So sometimes they get very annoyed, they get very upset about why we did not answer the call, or why we did not reply to the message. But we try to explain them that, this should not be happening, because that answer or the reassurance that they want from us should be coming from within. And that's the reason why we sometimes do not answer calls or messages. But yes, this regularly happens with therapy.
Right. Moving on to sleep crisis now. People say sleep is very important. I like to have my quality sleep, but at the same time, they binge watch Netflix till 3 a.m. So, do you think sleeping at one go, 1 to 8 hours, is needed? Because most of the people think sleep 8 hours is important. Now, I can take it in 3 hours gap, 4 hours gap, or 5 hours gap. So, can you talk about that?
Well, undoubtedly, sleep is one of the best medicines for the brain.
Okay.
And sleep continues to be one of the most important aspects of mental health. You could be doing everything possible, but just a bad night's sleep worsens your brain's health.
Okay.
And a lot of researchers say that the brain takes a lot of time, couple of days, to regain all that it has lost, even with one bad night's sleep.
Okay.
So now basically what happens is, every time you have a good night's sleep, there is a lot of wastes that is produced in the body being removed.
Okay.
So I say that sleep is like your housekeeping staff. It comes, cleans away all the waste materials and makes the brain fresh and clean.
Very well said.
Now, when somebody continues to have a bad night's sleep, all this waste is getting accumulated, which causes an inflammation in the brain. So it's something like, there is one designated area in our homes where there is kitchen waste. Imagine if you don't clean it for 2 days, that area starts stinking. When you don't clean it for 4 days, not just that area, but the surrounding rooms also start stinking.
Correct.
And when you don't clean it for 7 to 10 days, the whole house is stinking. Similarly, when these wastes start accumulating in the brain, it slows the brain down. I always say, when you have a good night's sleep, the chemicals moving in the brain are moving at a speed like how a vehicle passes on a highway. But now, when there is a lot of this accumulation and inflammation happening, the road which is supposed to be straight becomes this way. And now the speed comes down, the brain slows, and that is a very bad sign. And there are some recent studies which talk about how the brain eats itself to survive a bad night's sleep. So basically, when this continues, the brains are shrinking at a very young age. So 30s and 40s, the brain can start shrinking. Usually what should be happening post 70 or 75.
At a very later age. Okay. So do you think 8 hours is a compulsion? What about the sleeping hours?
So, well, one, when it comes to the duration, 6 to 8 hours, 6 to 9 hours is what WHO also recommends. Some individuals can feel, well rested and feeling fresh after 6 hours. Some people might need 8 hours. The first thing I would tell people is, stop wearing a smartwatch and keep calculating your sleep, because that's not, the right way. I think the best way to actually calculate your sleep is by yourself. When you wake up in the morning, if you're feeling fresh, that's great. Now, coming to when you should be sleeping, there's again scientific evidence for it, because melatonin is a very important chemical that the brain needs to have a good night's sleep.
Okay.
Now, melatonin is only produced between 7 p.m. and 6 a.m.
7 p.m.
Yes.
Okay.
So now you need to finish your 8-hour sleep in this 11-hour span.
Okay.
So ideally, sleeping around 9:30, 10 and waking around 5:30 is the best time, because post 6 o'clock, it is only the body resting but not the brain. So when individuals tell me that, I had a party all night, so I slept at 5 a.m. and I woke up at 12 p.m., it's a very bad sleep. The brain has not rested enough. And that's the reason a lot of individuals know this. When they have a bad night's sleep, the next day, despite sleeping for 8 hours, in odd hours, you still feel very lethargic. You have a lot of sugar cravings. You're irritable. You're very slow, and you develop some muscle cramps. All of this is happening because the quality of the sleep has been very bad.
What schedule do you follow?
I sleep by 9:30, 10. All thanks to DPS. After my daughter coming to DPS, because her school starts at 8 o'clock, so we wake her up by 6:30. So I like to wake up 1 hour before her so that, I can give some time for myself.
yourself, correct.
So I try to sleep by 9:30, 10 now, and I'm waking up by 5:30.
What is the weirdest sleep advice you've heard somebody follow? And can you just let our viewers know that you're not supposed to do that? Also, can you talk about power nap? People say after having lunch, they feel extremely sleepy. Do you think that power nap is important?
Well, firstly, when it comes to power nap, there are some recent studies which talk about, frequent napping. But when I say frequent napping, I'm talking about 5 to 15 minutes maximum. Unfortunately, what happens is when somebody calls it a power nap, it's couple of hours. And when that happens, it undoubtedly disturbs the night's sleep.
Correct.
So 5 to 10 minutes of a power nap is acceptable. More than power naps, I feel taking regular breaks from what you're doing is something that is good. And coming to the weirdest sleep, story that I've heard is, drinking alcohol and sleeping. I think
Oh my God.
they say that, I sleep like a pig when I drink alcohol. That's very, very bad. It is just that, it is keeping you, in a sleeping state, but the quality again is very bad, and alcohol itself starts disturbing the sleep center in a few years, and after a while, even the alcohol is not going to help.
Talking about alcohol, many teenagers, adults, older generations, be it anybody, they have started turning into vapes, hookahs, alcohol, and every day I read reports about how young teenagers are admitted in hospital because they are addicted to vape. But the talk that goes on among adults is that hookah is better than cigarettes. Vapes are better than hookah. So it actually doesn't do any damage. Can you please break that myth for our viewers right here?
Well, undoubtedly, vaping is one of the, most addictable substances today.
Okay.
Because easily available and a quicker nicotine delivery. A lot of individuals believe that it is nicotine free, but unfortunately, at least in India, there is no regulatory body that is actually, watching into what is inside that. So you frankly do not know what you are consuming while you are consuming the vape. And undoubtedly, there is a lot of addiction that we are seeing. Some people tell me that, they are switching into vaping because they want to quit smoking. But vaping is not an FDA approved treatment for quitting nicotine. There are other FDA approved treatments which should be used. So it's just a reason to take quicker nicotine in a flavored form. And undoubtedly, it has very bad effects both on the lungs as well as on the brain. There are also a few cases of cardiac arrests in very young individuals who are into vaping. So all the young adults who believe that vaping is safe, it's not. Similar with cannabis, a lot of people who believe that cannabis is herbal, it's absolutely dangerous. And undoubtedly, we know about alcohol and nicotine. The biggest question people ask me here is, then why is it legal in a few countries?
Exactly. Yes.
Legality has nothing got to do with safety. Alcohol is legal in India. That doesn't mean that, we introduce alcohol to every school going kid. The reason we don't do that is because it's not safe. So similarly, be it alcohol, nicotine, cannabis, vaping, all of them are absolutely risky for the human health.
One more thing, when people say cannabis, it really helps me think better.
Right.
Alcohol keeps me awake.
Right.
So what do you have to tell them about this?
They could be doing that temporarily. So now what happens is, there is this famous saying which says, alcohol doesn't solve the problem but helps you forget the problem.
Correct.
But that forgetting is only temporary. So I could drink alcohol all night, forget my problem, but when I wake up in the morning, I'm again
Still
sitting
there.
with that problem with a very weak, lethargic brain. So undoubtedly, these substances give a temporary relief, but that temporary relief comes with a very high risk. The high risk is shrinkage of the brain happening at a very young age, neuronal dysfunctions happening, and we are looking into people developing withdrawals and developing psychotic episodes because of these substances.
Correct. Talking about psychotic episodes and on the similar topics, getting back to Instagram, web series, and now we are talking about adults. Do you think it somewhere is affecting their relationships in terms of expectations that they are able to watch or compare on Instagram and the web series? How has it impacted the adult relationships? Have you got any such cases where this is the actual reason and that has spoiled several things?
Well, it's quite common when we see individuals getting inspired from what they watch on the screen.
Especially K dramas. Sorry to interrupt.
You know,
Um,
so now when it comes to their expectations about romance,
hmm,
their expectations about intimacy,
hmm,
their expectations about how friendships work, their expectations about how an individual should fight for his right, or how an individual should fight for the person that he loves,
hmm.
or how an individual should work very hard relentlessly, not crossing all the boundaries to win the girl or the boy that
Correct.
they want. All of this is clearly influencing people, and this is even converting into behaviors which is very wrong.
Hmm.
So yes, everything that we watch on the screen need not be reality. And lot of adults who believe that probably when somebody is watching this also could be thinking, oh, I know all of this. Despite you knowing all of this, when your brain is receiving a lot of this information, the brain changes.
Hmm.
And when the brain changes, it is beyond your control to stop the brain from having a thought. So thoughts, emotions, and behaviors to the greatest extent are not in our control. So you need to be very clear about what content you are giving. So it's something like I believing that I know that ice cream makes me fat, but I can still eat it and control it. You cannot. So when you're giving something that is unhealthy, the body is going to respond in a negative way. Similarly, when you're giving something unhealthy to the brain, the brain is going to show it up, and it is beyond our control to control it.
Talking about the same beyond our control, do you think is this the reason why crime rates are going up, be it India or any other country? The kind of so-called thriller crime web series that we are watching or that we are into, be it movies or web series, the kind of content they show, do you think that is somewhere giving us the idea, or do you think the directors have taken idea from the real life situations and showing it in the movie? At the end, most of the people are getting access to such content. So do you think that is one of the reason why being violent and being not able to control anger and crime rates are going up?
Well, there are two ways of looking into this right now.
Okay.
One, when things are put up in the OTT, there is no age bar. Everybody gets an access to this content.
Absolutely.
And now, like I said, some brains are not totally developed yet where they understand the difference between what they are watching and what a real life situation needs to be dealt with. That is the greatest risk. The second thing, like I said, even if you are an adult, when you're watching this regularly, your brain normalizes this behavior. So a lot of times, be it using abusive language when you are angry, or expressing some harshness in the words or in your actions, these are very basic things. I'm not even talking about crime. Things that happen in every household, using an abusive language or an expression, or just raising the hand, or showing some kind of harsh behaviors, punishments. We are all learning this somewhere. Now when it comes to the other side of the age group, you are modeling things. A lot of times children tell us, we've seen our favorite actor do that. This is how he fights for his girl. This is how he goes and bashes somebody. And these are things that our people are learning. And there is a lot of evidence which says that when you constantly watch crime, there are few brain areas that change. Especially the fear center or the anxiety center called as amygdala
Okay.
is hyperactive or hypervigilant in these brains.
Okay.
And this can later push you into one, developing some serious personalities like psychopathic personalities. Two, developing some serious psychological health issues like anxieties also. Where you keep worrying about everything in the real world. Something called as the mean world syndrome, where you look at everything and you start becoming suspicious. So
Okay.
people who watch a lot of Crime Patrol, they start questioning everything.
Everything.
Oh, the maid is behaving this way, maybe there's something. So this
Okay.
kind of behavior sets
Hmm.
into our head, and once the brain changes that way, it's a very scary thing.
Then what's the easiest way you can tell if you're addicted to something, be it alcohol, nicotine, or even social media?
Well, I think couple of criterias that we look into. One, excessive usage. Two, not able to resist without using it.
Hmm.
Three, prioritizing it over your health, prioritizing it over family and other important aspects. These are few things that help us understand, because somebody can tell me that, okay, I drink only in the weekends.
Mm.
But if you're needing something like alcohol to relax your brain every weekend, it's addiction.
It's addiction. Okay.
Similarly, when it comes to screen time and somebody wants to prioritize screen over an exam, or somebody is sitting in a group but still using the phone, these are warning signs which say that the brain is actually developing that whole loop of addiction.
Right. Then what's the most extreme withdrawal case you've ever seen?
Well, withdrawal to substances like alcohol, cannabis, and nicotine is what we commonly see. Where people develop irritability, sleep disturbances, sometimes, hallucinations, delusions. These are the kind of things that we see. But in the recent times, we are seeing clear withdrawal from behavioral addictions, that is social media and screen, where people are developing a lot of sleep disturbances and irritability, especially when the kid is not allowed to use it. The irritability goes up to an extent where they start even physically abusing the family members for taking away the gadget. And this is a very clear indication that screens and social media are as addictive as what cocaine and heroin are.
Oh, okay. What about food? When we say alcohol, we are addicted to alcohol, that's making our body worse. But do you think some people have even craving to extreme food? Like if they are emotionally not doing well, they turn to food.
Right.
If they are unhappy, they turn to food.
Right.
So do you think that is equally bad? Let's not compare alcohol, but again, if you keep consuming food, does that even fall under addiction?
Well, theoretically, it does not fall under addiction, but when
Okay.
you look into what's happening inside the brain, it is a low dopamine state where the brain is asking for some sort of dopamine. And now the individual is trying to give that kind of a pleasure chemical through food. And a lot of times when we talk about binge eating or stress eating, it's something that is unhealthy, something that is heavy with sugars or high in calories, or having a lot of unhealthy oils in it. So this is something unfortunate, and this is something undoubtedly bad, unhealthy for the brain. And if there is a particular behavior like this, they need to be understanding that there is an underlying stress which they need to deal with, which is actually coming out in this form of a particular behavior.
Can we call it addiction as well?
We cannot call it addiction, because for me that same food item need not be necessary. I could be wanting an ice cream, I could be wanting a chocolate, or I could be wanting to eat a biryani. But somewhere that impulsivity that is there is something which needs to be addressed.
Okay.
So it's more of an impulse control related issue.
Right. Coming to the last segment, doctor, let's end it with a fun rapid fire round, but I want it to be unfiltered, the real Virinchi that people don't know. One mental health myth that needs to die right away.
Everybody who's a non-psychiatrist starts talking about psychiatric medicines and why people should not be using it. Starting from gym trainers to, wellness coaches. When my client meets them, they say, don't take the medicines. So one, medicines are not harmful, medicines are not addictive, and they need to be treated. And the second thing is, we've spoken about it. Not every preacher is a therapist.
Right. If stress was a person, how would you describe them?
It's something like those people who are charming, but after a point they become very toxic. So
Right.
it's superficially charming, you enjoy doing it, but at one point it starts becoming toxic. So it's probably, somebody having that narcissism in them.
Um, it is said that hugging scientifically is proven to help, or is it just emotional nonsense?
No, it's absolutely true. It's scientifically proven. Hugging, kissing, holding hands, communicating, talking to your loved ones, just looking into their eyes, all of them releases a particular hormone called as oxytocin.
Right.
And oxytocin gives you that sense of security. So, starting from, children, newborn kids, newborn babies, the reason why they need that touch with the mother and why they need that constant communication is for oxytocin. So, big yes to hugging.
Hugging. What's the weirdest thing someone has ever gotten too attached to?
Well, I think watching porn.
Okay. All right.
This individual needed to watch porn before every important activity because that would
Okay.
relieve his stress. Somebody's told me, sir, I've attended enough therapy sessions. I think I can start my own center now.
Oh my
I was
God.
like, bhai, mat karo. Just
Oh
learning
my
something
God.
doesn't make you a therapist. So I said,
Doesn't it make you angry? अरे ये session तो कोई भी कर सकता है. क्या करने? You have to just sit and talk. How do you deal with such kind of people?
So, somebody's once asked me, आप सिर्फ बात करने के लिए पैसे लेते हैं? So I told him, नहीं, बात करना तो complimentary है, मैं आपको सुनने के लिए पैसे
Oh
लेता
my
हूँ.
God. Right. What's something someone did in therapy that made you think, no way, this cannot be real?
I think, like I said, coming drunk to the session, he had an explanation for it, but that's a very big no-no. You can't do that.
Are you a reader? Do you read books? Is there any book that has changed your life or thinking for that matter?
A lot of books, but I think in the recent times, especially when I'm dealing with mental health, Bhagavad Gita is one book that has actually, taught me so many skills,
Right.
which I don't just apply on myself, but I also apply it on my clients.
Okay. All right. If your profession had a tagline, what would it be?
See, there is this very beautiful saying which says, mental health experts or mental health gives you hope when your brain does not believe in it.
Okay.
So when your brain believes there is no hope, mental health is something that gives you that hope.
Right. Have you ever had a patient who faked a mental illness for you?
Oh yes, exam time.
Oh my God.
So exam time, kids come up with
Really? Okay.
headaches and they come up
Mental
with stomach.
stress. Right.
But still, most of this happens because of stress. So unless we rule out stress, we cannot call it as faking. Because I remember this. I just want to say this because I remember one of my schoolmate who always had a pain abdomen before his exams.
Okay.
And as a child, as a schoolmate, I made a lot of fun of him. Not just me, a lot of us. And it was much later when this boy came to me for treatment. And, he doesn't remember, me making fun of him. But he told me, Virinchi, mere saath ye school mein bhi hota tha. And I remember that. So that's when I realized, unless you rule out everything, you cannot say that the individual is faking. And students ke saath kahi baar hota hai, headaches, pain abdomen, non-specific pains can be because of stress.
Right. One last question. What's the funniest excuse someone has ever given to you for missing therapy?
There was this girl recently who told me, sir, I was so excited that I'm coming for your session that I was watching your podcast all night and I didn't wake up in the morning.
Oh my. Maska laga ke chhod diya, right? Before we wrap the show, if you had to go back in time and tell yourself something that, yaar ye nahi karna tha, ya you would have done this better, what advice you would have given yourself?
Well, there were many things that I used to feel like this, but in the recent readings that I'm doing, I understand that you need to accept everything that has happened. Everything happens for a reason. Probably you do not know why this has happened right now. Maybe you're not able to, make a meaning out of it, but time is actually going to unwrap everything and unleash everything. So I believe everything happens for a reason.
Thank you so much for giving your time to us. And this has been one of the most intense, insightful, and rather much needed conversation that we need to have. But before we wrap the show, like I mentioned, you're a human mind reader. Do you read me? What do you think about me while we are doing the podcast? Do I fall under the stress category, or you think I'm doing absolutely fine?
Firstly, thank you so much for inviting me here. I've always known about your creativity. I've read your writings in the newspapers for many years, and I've always seen you as that confident person who would come up with creative ideas. I remember, you would talk to me about a few topics. You were not sure if your higher authorities would accept it, but
Yes.
in the next day's newspaper I would see that article. So that clearly talks about the kind of strength and the kind of perseverance that you have towards making things possible. So I'm very proud of everything that you're doing, and you are a very confident girl.
Thank you so much. Likewise. In fact, my dear viewers, let me inform you, when I was working as a journalist for Deccan Chronicle, most of the stories were inspired from Dr. Virinchi Sharma. The number of case studies that he used to give me, the patience he had to make me explain each and every complexity that happens with the human mind. And this conversation was nothing but delightful. It gave us a lot of insights about the human mind, the human behavior, and some questions I'm definitely sure that you will be asking yourself after watching this talk show. And I think you should, because mental health is as equal as physical health. Thank you so much. And this is a wrap on The Social Scoop with me, Bansari Trivedi, and Dr. Virinchi Sharma. Thank you.